you for inviting me to this important meeting. In the coming 15 minutes, please allow me to take you to a tour on social media in healthcare. In this tour, we are going to use public data, and there is no any private data involved. We are going to draw a disease map on social media, and we are going to discuss how to analyze this healthcare data on social media to direct the communication stream among healthcare professionals and patients in order to deliver the disease education, to engage patients, to achieve the goal, prevent disease, and to treat disease. It is not a surprise that today most of us have used a smartphone, and smartphone give us opportunity to send a message from one side of the world to the other side within seconds. The message delivery speed, it is not counting by days or hours, but minutes and seconds. With such huge amount of message and data, especially on social media, the public data, how can we make use of it to benefit the healthcare professionals and benefit patients? We don't have any shortage in data today, but how to organize them to get the real insight of the data to let them tell us the true story. We use chronic heart disease as one of the examples. We spent 21 months to collect the posts which related to chronic heart disease on Twitter and Instagram to draw this disease map. And you can see every green board means in that geographic area there is post about chronic heart disease happened, and the number on this green board means how many posts has happened. As we use English language as the detector language, it is not a surprise that we see the US, the UK has most of the posts. However, chronic heart disease, this topic also spread all over the world. In the bottom of this statistical report, you can see how many posts happened every day in these 21 months. However, we don't want to only state on the map. We want to know who are talking about what on social media about chronic heart disease. I extract some examples for you. From here, we can see education, broadcasting, patient, family, and hospitals are all involved. Not only for common disease, but for rare disease, is also not silent on social media. The Fabry disease is one of the examples we used in rare disease. And this disease is reported to be 1 in 80,000 live births. However, in real life, we can see 1 in 3,000. This is again the disease map. It is not a surprise that the number of posts is much smaller than a common disease. We use 3 months to draw the disease map and also monitor how many posts happened all over the world. Again, this is in English language. And if we involve Japanese language, we can see the map is expanding. For the data analysis, we don't only state on the map only and the daily statistical report. We want to understand who are talking about the disease on social media. From here, we can see academic has raised strong interest in this disease. 59% of the posts are from academic. And for medical doctors, there are 15%. However, there is only 1% of posts from medical doctors indicate they have ever seen a Fabry disease patient. I think this is not a surprise because the patient is very rare. The patients are also very active. We discovered 11% of posts are from the patient. And what they are talking about, we categorize further on these posts and to specify these posts into 2 big categories. One category is academic organizations, doctors. Another category belongs to patients. In academic, we can see the most interesting topic on social media is disease detection, clinical research, patient recruitment, treatment. And for patients, they are very keen to share their lives, even try to stay together to support each other, how to do sports, how to eat, and how to find a good insurance to obtain the better health care. From these 4 trends, there is one message is from Instagram that we can see in academic. In this group, tend to use terminology most, and in patients, when they describe their life and symptoms, they use very common language. On social media, the message is free and to be shared for free. However, we discover a very interesting phenomenon. Academic and doctors stay together, and we rarely see a patient treating a doctor's treat. And for patients, they also tend to stay together with patients. This is a patient lead, a Fabry disease, and this patient is actively sharing her life experience on Instagram, almost post 1 to 2 photos to indicate how she lived with disease. And I think most of us know Fabry disease, the patient has burning hand, burning feet. This pain makes people suffer every day. And this patient managed to do sports to control this Fabry pain. And from this message, we can see there are at least 3 patients, Fabry patients, follow her. And one of the patients is just recent diagnosed. And she expressed that, I feel like there is still so much unknown. From here, we hear the patient's voice. They are calling disease knowledge. They are calling qualified disease education on social media. How about a doctor? We discovered one post from a doctor. He's very excited on that day. That was last year. He has seen an 11-year-old Fabry patient and his family. It is a very interesting presentation, he said. Love hearing about the patient and family's understanding of disease process. This doctor has raised his voice that the doctor can also learn from patients, and patients' life experience data can contribute to the good disease understanding to bring doctors more closer to patients' real life. Unfortunately, there is only one person retweeting his message, and we can imagine his message is covered by millions of tweets every day. The voice is becoming weaker. This brings us a question. How can we make the doctors' and patients' voice stronger? Let them hear each other. How can we bring a bridge between patients and doctors on social media? We use a patient day to do an experiment in spring this year. Pardon me, I cannot disclose the disease name because this is under the publication. One of the first publication will happen in next month. So on this patient day, we invite patients to the hospital and at the same time also communicate the message on social media. We mainly use Twitter. It is because our chief investigator are preferred to use Twitter and most of academics stayed on Twitter. Before the Twitter patient day, we draw the disease map and also to analyze who are talking about what kind of topic about this disease on social media. Before the patient day, you can see this is the first patient day's retweet map. On this patient day, on the first day of the preparation, we can see the orange bar means researchers, yellow bar means organizations, patient organizations, and the blue bar means media. And the green bar means patient. We can see the patient's involvement is very little. Our investigator, based on the disease map and the analysis report to communicate, choose the topic on social media, continuously communicate with different stakeholders for 2 weeks. After 2 weeks, on the patient day, we can see the ball is getting bigger and bigger. We collect more people, and the green ball of the patient represent the patient's involvement is much more than from the first day 2 weeks ago. We analyze this data. There are 11% of our counts are patients. On the patient day, physically, there are less than 300 patients participate. And on social media, we have covered more than 20,000 followers. However, we don't expect every follower to receive the message, will read the message. If we see there are 40% of followers read the message, on this patient day, on social media, the population coverage is 8,000, and the geographic coverage goes through 4 countries, the UK, Netherlands, Australia, and the US. Because we use English as the communication language, it is not a surprise that, again, most of communication falls into the English-speaking countries. However, after the patient day, we are facing another challenge. Patients went to the hospital on that day and they went home. And on the social media, patients join in the discussion on that day. They stay on the social media. But we want to engage these patients on social media and also transferred the patients physically participated patient day to social media to engage them in a remote method and to provide them systematically and long-term education. What can we do? We use MediSoci as one of the solutions. So in the coming slides, this is a real-life data showed about Fabry disease, how we are using MediSoci to bring healthcare professionals and patients on social media to put them together, and also to launch an educational website to introduce it on social media. MediSoci is a system supported by data analysis technology on social media. So MediSoci received a disease map, and the data analysis the time gap can be every hour or every 24 hours to feedback to MediSoci what is the topic about the disease and what's happening about the disease on social media. This is the first page of MediSoci to introduce what is Fabry disease. And the second page, we can see this is a place for patients, healthcare professionals to express their opinion or to share the symptoms or to share the treatment experience about the disease. In order to provide the privacy, patients or healthcare professionals can choose either use a nickname or to only send out a message without indicate any personal message. And we have chief investigator here to direct the communication stream, and the patient lead again to share her life experience, how to cooperate with the disease. And in the last part is a campaign, and this campaign is continuously changing the topic with the periodically reviewed of the data analysis system and the disease map to direct what will be the next campaign in order to raise the patient's interest and also to release some misunderstanding on social media based on the disease map and analysis report. And in the bottom of this campaign, we can see patients, healthcare professionals can be involved to share the experience. For example, this campaign is a patient to share his lifelong example how to cooperate with the Fabry pain in daily life. And in the bottom, there is patients can share their experience, how they cooperate with these symptoms. And for MediSoci, the meaning is not only to educate patients, as patients can go to this platform to share their real-life experience in a secure way. All of this message can be analyzed again to give us a disease map with real understanding of the disease, and also to monitor whether the certain symptoms, for example, has a relationship in the certain geographic area. If we do the campaign again and again, after several campaigns, we can draw a real-life map on social media to indicate the real understanding of the disease from patients and healthcare professionals. This is the end of the social media and health tool. However, it is not the end of the journey. We are just in the beginning of the journey, and we have seen great hope, and we have seen great opportunities. If we organize the data in the right direction, the data will tell us the real life of the disease and help us to rewrite the disease landscape. Thank you.